It's my feel-good breakfast show.
We call this a feel-good breakfast show because it's all about that. This is your show, and this is also your number, 0839133728, if you want to give us a call this morning. We're talking vitamins, A, B, C, D, the whole alphabet. There's one for everything. Now, before the break, we talked about which ones are for which disease option, lack of. Dr. Darren Green is back in the studio, back from Antarctica.
Yes.
Doctor, let's start with vitamin A or
Yes.
retinol. You sometimes see it in the creams that they prescribe for women, and they say it's so good for us. Why do we need vitamin A?
Yeah, so vitamin A is quite important with certain components in your skin, but also, more importantly, vital functions for life are things like your eyes. So everyone speaks about beta-carotene, and they understand the need to consume vitamin A specifically for things like night blindness.
Sure.
So you get people that can't see very well at night time. Often it's genetically linked. Otherwise, it's related to your diet.
Oh, so that's what's wrong when I can't see. Okay, so what is... Okay, we know now what it does. Does it get stored in the blood? How does it work?
So vitamin A is one of the fat-soluble vitamins,
Right.
A, D, E, K, so ADEC. So that means it gets absorbed in the intestinal tract. So, you know, it's fat-soluble, so it diffuses out of the gut into the bloodstream via the gastrointestinal tract.
Okay. Doctor, what happens if you take vitamin C, ascorbic acid? What is it good for?
Yeah, so it's one of the antioxidant vitamins, like vitamin E and C, both in moderate dosages are useful as antioxidants. They take away all the free radicals that are the bad products of metabolism of the cells. However, you do need a certain amount of free radicals present, so you mustn't go and overdose on vitamin C and vitamin E, for example. So in your immune system, does certainly depend a little bit on vitamin C. So that's the association with colds and flu, for example.
Okay. So I have a question around that. So when you are sick already or you have the colds and flu symptoms and you take vitamin C, is it too late?
It's too late. It's too late. It's about prevention and getting your immune system
Right.
up beforehand. There are studies that have been done looking at the outcomes of influenza, for example, with high doses of vitamin C. And, you know, I'm afraid the effects or the outcomes aren't significantly changed.
So there's so much out there and people have so many opinions. How do you know what to
Correct.
take? I mean, I remember, now you're pregnant and you take a handful of pills because by the time you finish there, everyone has had something to say. I want to know about
so
that,
many,
hey?
yeah.
I mean, quickly, we've got 30
You only
seconds.
need a few of them, really, in pregnancy, especially the first trimester.
Yeah.
You can imagine you need omegas for the
Yeah.
nervous system development. You need iron because your iron levels as the mom carrying the fetus actually drop quite considerably. And, you know, obviously you need to look at folic acid because when the nervous system is actually made, the spinal cord, the brain cells, and that development occurs.
Ooh, it sounds so
we need it.
yummy to make a little baby man with a healthy brain. Oh, listen, stay with us. We're talking vitamins on the show this morning. I want to talk about vitamin B because everyone says, no, you can't have that injection. Jy piepie dit net uit. En, ag, almal het altyd iets te sê, want ons het ons dokter in ons ateljee vandag, so ons kry eerste hand advies. ZBZ, middle child Brown, what's happening, girl?